Hello, my name is Nurse Engee. Today's topic is delirium. Delirium. Every shift, nurses assess vital signs, but one of the most dangerous changes can be measured with a monitor. Acute confusion, sudden inattention, fluctuating awareness, these are the early signs of delirium. A medical emergency hiding in plain sight. Delirium is often misunderstood. It appears suddenly, fluctuates unpredictably, and yet, unlike dementia, it is often reversible. In healthcare settings, especially among older adults, delirium is a medical emergency that demands early recognition and prompt nursing intervention. This topic explores the pathophysiology, the clinical features, and the nursing care of delirium. Delirium is an acute disturbance in mental status characterized by sudden changes in awareness, attention, and cognition. One critical fact to remember is that delirium always has an underlying cause. Unlike dementia, which develops gradually over time, delirium develops rapidly, sometimes within hours, and fluctuates throughout the day. The good news is that delirium is often reversible when the cause is identified and treated promptly. Pathophysiology. Delirium results from disruption in brain function, often caused by physiological stressors. Older adults, especially those aged 65 and above, are at increased risk. Factors such as hypoxia, where the brain does not receive enough oxygen, dehydration, malnutrition, uncontrolled pain, and sleep deprivation can all precipitate delirium. Medication effects are also common contributors. Opioids, benzodiazepines, anticholinergic drugs, and medication withdrawal can alter neurotransmitter balance and impair cognition. Electrolyte imbalances, particularly sodium abnormalities like hyponatremia, can rapidly affect brain function. Metabolic disorders such as hypoglycemia may also present as sudden confusion. Infections play a significant role as well. Delirium may be an early warning sign of sepsis, fever, positive culture, or acute changes in mental status should never be ignored. Additionally, organ dysfunction such as liver failure, causing hepatic encephalopathy, poor cerebral perfusion following stroke, or postoperative effects of anesthesia can all lead to delirium. What are the clinical features? Clinically, delirium presents with a sudden onset of symptoms. One hallmark feature is an altered level of consciousness. Patients may fluctuate between being alert, drowsy, or even difficulty to arouse. A key diagnostic feature is impaired attention. Patients struggle to focus, follow instructions, or maintain a conversation. Disorganized thinking is also common, with rapid topic changes and illogical speech. Sleep-wake cycle disturbances are frequently observed. Symptoms often worsen in the evening or nighttime, a phenomenon known as sundowning. What are the types of delirium? Delirium presents in three main forms. Hyperactive delirium is marked by agitation, restlessness, hallucination, and emotional lability. Hyperactive delirium, often overlooked, involves lethargy, reduced responsiveness, and slowed activity. Mixed delirium fluctuates between hyperactive and hypoactive states, making assessment especially challenging. Now let's look at the nursing intervention. Effective nursing management begins with treating the underlying cause. Pain must be adequately controlled. Offending medication should be discontinued when appropriate. Fluid and electrolyte imbalance require prompt correction, and infections must be treated aggressively. Environmental management is essential. Overstimulation from noise and bright lights can worsen confusions. Nurses should create calm, structured environment and ensure patients have access to glasses, hearing aids, or other assistive devices. Frequent reorientation is vital. Family presence, familiar objects, and personal photos can significantly improve patient outcomes. Maintaining a normal sleep-wake cycle is equally important. Daytime exposure to sunlight and activity helps promote nighttime rest. At night, lights should be dimmed and noise minimized. Physical restraint should always be avoided and used as only the last resort, as they can worsen agitation and increase the risk of injury. Remember, delirium is a medical emergency, but one that nurses are uniquely positioned to detect early. Through careful assessment, timely intervention, and compassionate care, delirium can often be reversed. Early recognition saves life. That ends today's topic. See you next time.